Good afternoon. I welcome you all in my webinar on recurring acute and chronic pancreatitis using Ayurvedic formulations. Friends, as you know, pancreatitis is an inflammatory disorder of pancreas. And what's special about it? It is the disease of 19th century. It was not existing in ancient world. The study reveals that first case of pancreatitis came into existence in 1889, and that was the beginning of a disease which has become one of the killer diseases in the world. Over the years, the disease has spread over. Once believed among alcoholic, among people with family background, the disease is rising rampantly in different parts of the world. When we live in India, we have seen the disease was more prevalent in southern state of India. But now, with our experience, which is spread over in last 22 years, we found that disease is more prevalent in northern India, more among non-alcoholics, more among non-family background. Is experience that what is the cause and what is the cure through a PPT. There will be a room for question answer after the end of this webinar. And before that, I would like to make you familiar about the word pancreatitis. Pancreatitis, as I said, that it is an inflammatory disorder of the pancreas. And when it happens, it brings the blockage within the pancreas. The juices, the enzymes, the hormones which are responsible for the metabolism, for the digestion, they don't move out. And then the deadly. There are two types of pancreatitis, acute and chronic. There's some confusion in these two words. Acute means here that symptoms of the disease with acute exacerbations, but with no changes at the image level. And in chronic pancreatitis, exacerbations of the attack are there with symptoms, without symptom, but there are sequential changes in their morphology. As I have explained you, that the disease has invariable characteristics about its diagnosis, but the most common factors are Tiger O, toxins, idiopathic means no reason, genetic, autoimmune, recurrent and severe acute pancreatitis, and obstruction that may lead to chronic pancreatitis. And what are the symptoms here? First of all, moderate to severe abdominal pain associated with nausea, vomiting, backache, weight loss, fat in the stool, and uncontrolled blood sugar. These are the most common features which are seen in chronic pancreatitis, but there are cases who may not experience such things, and it can progress silently. Now the question comes, who can diagnose pancreatitis? So the answer is that pancreatitis should be diagnosed by a competent gastroenterologist who is not only well versed with pancreatitis, but he knows all about the diseases of the digestive tract. There are clinical symptoms, there are pathological symptoms, and there are images. But the most authentic, non-invasive diagnostic criteria is MRCP. And the second one is ERCP, which is invasive. And ERCP has three roles here. One is diagnostic. Sometimes it causes it, and sometimes a patient is relieved by ERCP procedures. But there are other features also, like endoscopic ultrasound, CT scan, blood test, serum amyloid lipase, when they are more than 3 times than the normal, with other features, then a patient is considered with the pancreatitis. After diagnosis, we talk about treatment. So what is the treatment? So there are two types of treatment: emergency management and post-emergency treatment. And emergency treatment includes hospitalization, IV fluid, painkillers, antibiotics, or antioxidants, vitamins. And after that, then there is a diet, no less protein, less carbohydrate, less fat, low calorie food, and enzymes for all life. तो इंटरनेट की स्पीड चाहिए हमें बढ़िया अभी बोलो उसे
आवाज आती है आवाज भी नहीं आ रही थोड़ा 1 मिनट ऐसे चलता है
How to diagnose pancreatitis? So the question is very simple, and answer is more simple, that pancreatitis should be diagnosed by a competent gastroenterologist who is not only well versed with all about pancreatitis, but also knows very well all other disorders of gastrointestinal tract. There are clinical signs, pathology, and radiology, but the most authentic non-invasive diagnostic tool is MRCP. ERCP is also there, which is invasive, but ERCP has three components here. One is diagnostic, second is causative. Sometimes a patient may feel attack of pancreatitis after ERCP. Procedures are in the patient of pancreatitis to relieve with the symptoms of the disease. And there are supportive methods as well, like endoscopic ultrasound, CT scan, blood test, serum amyloid lipase if they are more than 3 times of the normal value. The question comes, how to treat pancreatitis? The pancreatitis could be treated in two ways. One is emergency management, and the second is post-remission management. The emergency is managed by IV fluid, antibiotics, painkillers, antioxidants, multivitamins, and no oral food at all. And the post therapy is multivitamins, antioxidants, enzymes, and very controlled diet to control the progression of the disease. Unfortunately, the disease in spite of all efforts, remain irreversible and progressive and leading to fatal stage. There is a data that 40% of pancreatic patients convert into pancreatic cancer and 90% patients develop uncontrolled blood sugar in their lifetime. The data from the West also say that 5 year survival is seen in 17% patient die within first 5 years of the diagnosis, 30% die in 10 years, and nearly 55% people are suffering with pancreatitis die within 20 years of the diagnosis of the disease. Friends, we have data from the West. We have no data from our country. Only except one study which says that the disease is more prevalent in southern state of India. And in the second study also, it says that India has pancreatitis, but it is a tropical chronic pancreatitis because most of the cases who come from India are non-alcoholic. So the study says that Indian scenario of pancreatitis is more prevalent among non-alcoholic, and protein malnutrition and mineral deficiency are known to be the major cause of the disease. And I think these findings are very important and quite relevant to our findings, where we find the disease is spread over all over India, more prominent among non-alcoholic with no family history. And with this fact, we have submitted a poster about the demography of pancreatitis patient in India. The data has been collected from our clinical practice. From where it came? My father was a Ayurvedic physician based in a small town near Delhi called Meerut, and he was practicing Ras Shastra. Ras Shastra means science of mercury and metals. He used to prepare his own medicines, which was taking years. And then in 1970, he started an experiment. He took copper, he took mercury, he took sulfur, he took 2, 3 herbs, and he started doing grinding, heating. And then a black compound emerged, which was not having the original thing, but it was a powder form. He didn't know what is the fate of that compound, what is making for. But incidentally, that compound was administered to a dying patient of cancer pancreas in 1972 against his own wishes, because that family was adamant that Vaidya should do something. That person should miraculously recover out of that compound. And that was the beginning of that black powder, which he named as Amar, in the treatment of pancreatic disorders. He saw success, he saw failures, he repeated the production. Sometimes he was successful, sometimes he was not successful, and one of the reasons was no process standardization. Anyway, I took this practice from him, and then I found that in cancer, result might be dicey. Some patients improve, some patients do not improve. But a disease called pancreatitis is showing wonderful response to this compound. We started documenting, and from January 97 till January 2019, we collected a data of 700 cases. So today, we have treated 700 cases who are well diagnosed in different hospitals of the country by the experts of the disease. And we started observing our practice, which is very much within the scientific domain of observational research. And here you can see the distribution of this pancreatitis patient, which are of different category. I want to make it clear that we are no party of the diagnosis. We don't know how to diagnose pancreatitis because we are not subject experts. I'm an Ayurvedic doctor who can formulate medicines following the raw material and the methodology described in our traditional text, and I can give it in my clinical practice to the willing patient. So when the patient come to us, they had been diagnosed with different forms of pancreatitis in a different hospital, which are depicted in this slide. This patient have undergone ultrasound, CT scan, ERCP, and MRCP along with diagnosis of each one. There was no doubt about the diagnosis of any of the case. And before coming to Ayurvedic treatment, majority of the patient has been to all this Asian Institute of Gastroenterology, Hyderabad, Vedanta Hospital in Delhi, Gangaram, All India Medical Institute. So these patients had been diagnosed, had been treated, and then opted for Ayurvedic treatment at their own. We found that the patient had the history of the disease minimum for 1 year to 15 years. In recent months, we are seeing few patients who are coming to us within few months of the diagnosis. And I think my next data, in my next presentations, I will have to include those because so far, till we generated this data, most of the patients were minimum 1 year or more than 1 year. One thing is universal about the disease. The disease is more common among men than women, and the average onset of the disease remains 24 years in male population. It's pity that it is the most productive age after adolescent. A person is becoming adult, that is suffering with dreams and want to move on. But here, the disease called pancreatitis is stuck their lives, affects their physique, affects their psychic, affects their pocket, affects their families, affects their dreams. And that's why I feel it, that this disease has a big challenge to the modern society. So there's a ratio called 1:4:1, that 4 men, 1 woman, about the new cases of pancreatitis. This is clear. As I said earlier, the disease is highly prevalent among the productive age group from 19 to 45 years. So, but the new trend is coming. There are children up to, we have seen from 3 years old, and the disease has gone up. Even today, I received an inquiry from Assam, where a 78 years old lady had recently been diagnosed with pancreatitis. But it is more prevalent 19 to 45. More the ages, lesser the symptoms, lesser the incidences of the disease. That's an interesting finding of our clinical practice. Is evident now that non-alcoholic, out of 700 non-alcoholic, are outnumbering alcoholics. Vegetarian and non-veg goes neck to neck. Non-tobacco, people have more incidences than tobacco taking. And the last is family history. Majority of the patient never had any family history of the disease in their family, but they had it. I think this information which I'm presenting in front of you, it's unique. No medical books from India or abroad has distributed pancreatitis in India that way. Though it is known that the patients are having disease from different parts of the country, but our research bodies, our government agencies, academic bodies, they never bother to count the number of the cases. So these 700 patients are distributed from, I think, in more than 22 states, and Uttar Pradesh is showing the highest number. But is it true? No. Here I come to Uttarakhand. Uttarakhand has a population of nearly 1 crore population. But out of that 1 crore population, we can see 42 patients. It is contrary to the belief that the disease is more in southern state of India, and Kerala is more densely populated than Uttarakhand. So we can say that our government agencies, our medical research bodies, our government should relook into the incidences of pancreatitis. They should have a comprehensive survey to understand the magnitude, its growing prevalence, and based on that, they should focus on trying to understand the rising cause of the disease, rising incidences of the diseases, and to make a control plan. So here you can see Bhopal, West Bengal, Punjab, Jammu Kashmir, everywhere. After talking about pancreatitis, its treatment in general in modern medicine, though there are many things has been done, the surgical interventions, now pancreatic transplantation, but still the disease remain unconquerable. We'll talk about Ayurvedic treatment. So what is Ayurvedic treatment? Ayurvedic treatment is a herbo-mineral formulation, and the study says that at the dose of 4 milligram per kg body weight divided into 3 doses, coupled with the diet between 1200 to 1600 calories a day, the 1 year long Ayurvedic treatment is quite effective, and sometimes few medicines depending on their stage, because most of the patients of pancreatitis have either this fatty liver, gallbladder inflammation, sludge, colitis, and other disorders of the GIT, like indigestion. Most common is indigestion. So these medicines which are described here are given with main herbal formulation for 1 year. And the last part, the disease has needs complete physical and mental rest. It's like repairing the road, that when you're repairing a damaged road, then you need to stop the traffic for a while. You need to make a bypass. So light food and normal activities, no exertion at mental and physical level, works wonder with Ayurvedic treatment. And here we see result at a glance. As I've said earlier, the disease has 55% mortality within 20 years. And in the last 22 years, we have also seen death, but that is now 1.2%. So apparently it seems very impressive that Ayurvedic treatment could bring down mortality rate from 55 to 1.2%. But if we say close analysis, we can see that it was not pancreatitis which was killing, it was comorbidity was there when there was high bilirubin count. So the two patients, I remember very well, when they approached us, their bilirubin was 20 plus. And in those cases, though there was a marginal improvement, but this patient could not sustain. So one thing is very clear, the patient with high bilirubin cannot be treated successfully with this approach. There are cases who were well, and after 4 years, sudden attack, and they could not reach to the hospital, and the nature of the disease. So we can say hardly incidental relapses, acute relapses. There was a heart attack. So these deaths are there, and 2 or 3 cases we can see the patient who had underlying liver disease and with exacerbations of that, but none of the disease could be established due to the toxicity of the treatment. 2 patients reported that there was a progression. They took medicine for 1 year, and they say they could not see any improvement. So we can count that progression of the disease. Again, it is non-significant in statistical terms. 364 cases, nearly 60% cases have completed 1 year Ayurvedic treatment and are leading normal life, disease-free life, and about 213 cases, 40% cases are on treatment. There are loss to follow-up, there are drops out, and there's one more interesting category here that they came for Ayurvedic treatment, they took Ayurvedic treatment, but they did not start because of so many inhibitions, so many if and buts, so many doubts, so many fears about the Ayurvedic treatment, because Ayurveda had been in India for 1,000 years, but it has not been tested with modern scientific tools. So their reason, their fear is quite obvious and quite natural. So in this category, we have 13 cases who took the medicine, but this is the data of past. Nowadays, we hardly find a person who come to us and is enrolled and does not take treatment. Now, this is 100% that whoever is coming after enrolling, they are not running away from the treatment. Now we come to a conclusion that 22 years and 364 cases we say that they have completed 1 year treatment. Then what happened to them? So an observation was made that what was their status 1 year before Ayurvedic treatment and 1 year Ayurvedic treatment. And here an statistic comes that before Ayurvedic treatment, in the previous year, 248 patients out of 364 has reported that they had weight loss. But after 1 year, that weight loss came down significantly low, and now out of, in comparison to 248, only 36 patients said that they have the weight loss. Weight gain. Similarly, weight gain was seen in nominal cases, but after 1 year of treatment, weight loss could be seen in high number of cases. Number of attack was rapidly high, which has also come down after Ayurvedic treatment. And when the number of attacks has come down, same thing, the number of hospitalization has come down, and it had all happened when none of the patient was given any enzymes which is must in pancreatitis treatment. So they were off pancreatic enzymes, they improved, but they were showing symptoms and attacks in spite of taking pancreatic enzymes. And in medical words, we say that it is a highly significant impact of Ayurvedic treatment in the quality of pancreatic patients. The disease has a progressive nature, and this is an effort to understand that. And not in the beginning, but now it is a practice that after 1 year of treatment, every patient undergo these MRCP and other tests. Again after 1 year, again after 1 year, and we are going to continue this practice. And so far, the finding is showing progression of the disease after quality of life is improving, the number of attack is decreasing, the number of emergency increasing, and second thing, there's no progression. It's important that the patient get better, how long they remain better. So in last 22 years, we found the patient who was first enrolled in this program in 1997 is still doing well. So it was to be, and the disease says that there is a very less non-significant relapses after the disease, and there is a sustainable effect of the Ayurvedic treatment. What is this treatment? This is the herbo mineral Ayurvedic formulation, and it is derived from the Shastra, which is one of the 8 clinical species of Ayurveda. And majority of the people who come to us for treatment, they are exposed to this type of manufacturing in our Rashala. It's a long process which takes nearly 3 years. And this Shastra is not new one. It is the science of 6th century. And these are the claims of the raw material used in the medicines: copper, mercury, sulfur, and 2-5-kinota Claytoria ternation lemon juice. These are the basic raw ingredients of these medicines. And these medicines, this is here, raw material is not so important because raw material is toxic. Mercury is toxic, copper is toxic, sulfur is toxic, even these 2 herbs, which has been demonstrated here, if consumed in raw form, they are toxic. The processing is important. And this is the traditional processing which converts these toxic metals into non-toxic therapeutic form. And here you can see the mercury, which takes nearly 9 months with these inorganic to organic and converts into an active material in the medicines. In this slide, we talk about copper. Copper is red heat and pour into sesame seed oil, buttermilk, cow's urine, triphala decoction, tulsi decoction, and then it's called purification of copper. But it is not purification. It is, again, a process to convert metal into a different form. Usually metals flatten when you hit after getting red hot. But after this process, metals break down. So something is happening and science is there, but not known what is going on. Third thing is sulfur. Sulfur is taken, again sublimated with triphala decoction. And now we have 3 things with us. We have processed mercury, processed copper, and processed sulfur. And when we have all together, then it is put into effect of Claytoria ternaceae and Laphaecinata, and it is ground for hours until we reach to a and like a dumbbell, 1 clay pot down, 1 clay pot on the top with a tube inside to take out the sulfur, and that is put on the fire. And this temperature is 350 to 420 degree, and it goes continuously. Fumes of sulfur keeps on coming, and when they slow down or they are not visible, fire is taken away, and they are allowed to cool down. And after cooling down, the material is taken out from the down. Some sulfur is on the top. Sulfur is taken separately. Down is collected separately, and then both are mixed together. So this is called one cycle of grinding and heating. That is called one cycle. And this process is repeated again and again to up to 100 times. And there is a say that if it is repeated, that is called Gandhak Jarna. So when you say this Gandhak Jarna with mercury, in the Shastra, these medicines are being prepared. And we can see that this one part of mercury is able to absorb two part of sulfur in this process. And it says Maharog Viduruna that it can cure the disease. So at this level, we are able to make this medicine in this form. And what we have found that initially, which was copper and mercury alone, over the years, it has gone into a complex mineral form, and we repeated three batches. And these three batches are showing consistency of this. So there is a formula of this medicine, though it is prepared using copper, mercury, and sulfur, but the end product is a mixture of this. This formula has been patented, and now this is called Amar, which is being used in the practice of that. So I hope that by this presentation, you are able to understand what is pancreatitis, what is going on, and what has been Ayurvedic treatment, how had it been effective, and what is this. We have tried to brought some science. We are trying to do more and more benefit. We have set up a facility for the people in the northern state of India, in Uttarakhand, in Udham Singh Nagar, where this is a 3-star facility. The patient have a separate rooms with their attendant, with the kitchen. And Ayurveda talks about regulated diet, regulated lifestyle, and medicine. We are not having any miracle. It's the science. Whatever we say, whatever we do, and we tried our best. The patient who are enrolled with us, they get better, and they remain better without getting any relapse. But a lot of science needs to be combined into that. I hope that our society, our scientists, our government will take note of our work, which is quite promising, and day by day the number is increasing. So at this moment, I thank you, all of you, for attending this webinar. I found this is a tool where I can talk to you long distance, and you are free to ask any question, answer, um, whatever you feel after seeing this webinar, after attending the webinar. And thank you very much for your time and for your patience listening to my talk. Thank you very much. So you are welcome for any question and answer in next 15 minutes. Okay.
How can we get the treatment?
बोलने मुझे
आ रहा है वो लाइव चल रहा है ये दिख रहा है सबको ये क्वेश्चन सबको दिख रहा
The first question comes, how can we get the treatment? So we have a secretariat, and which is run under Miss Isna Tiwari, who is a BTech biotechnology and had been working with us for the last 4 years. She's the program coordinator. So there is a number for her. There is a 9758509973. I repeat again, 9758509973, or one can go to our website ayurvedicpancreatitisclinic.com, and then there they can feed their information. We want to be sure that there was a bona fide case of pancreatitis. And once we get confirmed, once that Ms. Tiwari confirms that the patient has pancreatitis, they receive information about the treatment procedure, and this is our thing. So we want to be very sure that diagnosis is confirmed. The second question I can see here about the cost. So this is a package form treatment, and the present cost of the treatment is 3,15,000 for the whole year treatment. It includes screening, counseling, 3 weeks mandatory stay at our facility in Uttarakhand, in Udham Singh Nagar area, where a patient is given independent room with attendant and all meals. They pay extra for their blood pressure and sugar medicine, but and multivitamins if needed, and then every month treatment uh, till then, and they are monitored daily by email. So this is the present package, but with the latest some modification in the labor laws, because it's a labor oriented. Our raw material is very cheap, but labor is quite expensive, and I fear now that in next 6 months, these prices may go up to 20% because there's a steep high in the labor rate by the government, which is about 25% of the present one. And similarly, with all other taxes, these things are going up, but the present is 3,15,000. Okay.
Do we have to stay at home?
Yes, as I said, the first 3 weeks are important because it is quite interesting that patients of pancreatitis are not given, are deprived of dairy. And we start the first dose with malai. Malai, what is malai? You boil the milk and the upper skin of milk is malai. So nobody can believe that a patient of pancreatitis can get fat, but our dose is malai. The patient who are fearful, if we and we tried our level best to treat as a an OPD basis, but it was a total disaster. So first 3 weeks are mandatory to learn the treatment and to experience the benefit and then follow on.
Is MRCP available?
We don't do any invasive or non-invasive things at our place, but MRCP could be done in the nearby center, which are run by competent doctors.
Okay.
You can share your information with Ms. Sneha Tiwari at 97585099973 or by writing an email at padav@gmail.com, or you go to the website and you will get prompt response. And once we get that you are having pancreatitis, you will be explained everything about the treatment, and then you can choose for going it.
Pancreatitis, I will not work out. Please suggest me.
Once again,
I have acute pancreatitis. I will not work out. Please suggest me what to do.
do you have recurring attacks, or it was only one attack? Better you contact at the given number, share your information, and we will guide you honestly that what is needed. If you need treatment, we will call you. If not, then we'll say wait and watch, and we will wish you that you don't get further attack.
Does the treatment have any side effects?
We have carried a few toxicological studies as per OECD guidelines at acute, subacute, and chronic toxicity, and I'm very pleased to inform there is no grade 2 toxicity, there is no side effect. Yes, the medicine has to be taken properly with food. So apparently medicine have no side effect, and after 41 years of my clinical experience, I can absolutely say if taken well as guided, there will be no adverse effect of the disease.
Thank you again.
Thank you very much and hope to hear from you again.